In today's 2-minute top tip for our 30-day challenge, we are going to discuss how to optimize your exercise for your arthritis at home to ensure that we are giving it the best possible chance to improve your symptoms. This is vitally important because if we do exercise and it's not done properly, the chances are it won't work. If we think we have given exercise a good shot but it hasn't been done properly, the chances are you could go on to have invasive interventions that you don't necessarily need. So I'm going to give you a few top tips to ensure that we are giving the exercise the best possible chance to work for your arthritic symptoms. Tip number 1 is time. You do not go to the gym and then wake up the next day like Arnold Schwarzenegger. Our muscles and our tissues just don't change that quickly. So we are normally thinking about an 8 to 16 week period of exercise in order to give our muscles, tendons, joints time to adapt and change. Tip number 2 is consistency. During that 12-week period, your exercises need to be done consistently. If you do have a few weeks off in the middle, then the chances are that you are going to lose some of the adaptation and change that you have worked hard for in the weeks prior to your rest period. So do ensure that during that 12 weeks you're doing it religiously to give you the best chance of seeing some improvement in your symptoms. Tip number 3 is the exercise needs to be challenging. I cannot emphasize this one enough. A lot of the time I see a lot of patients doing exercise that they find easy. All this is doing is maintaining the current level of movement or strength that you already have. In order to stimulate change in your system, whether we're talking about cardiovascular fitness, whether we're talking about strength, your system needs to be stressed. That's how strength and conditioning works. That's how your body adapts and changes. So every time you do your rehabilitation or exercise, you should find it challenging. This leads us nicely on to tip 4, which is progression. The exercises have to be progressed during that 12-week period. The program should look quite different in week 6 than it did in week 1. The reason for this is because your body will adapt and change to the stress that you put it under. If you keep putting it under the same level of stress, it will stop adapting and changing. So we need to make the exercises progressively more difficult as your system becomes accustomed to what you're doing to it. Tip number 5, we're going to discuss exercising and pain. If you have pain and you're trying to exercise, it can be a very difficult thing to manage by yourself. If you are struggling with this, please get some help. The rule of thumb would be it is fine and safe to work into tolerable levels of discomfort as long as you're not getting a significant flare-up in your symptoms for the following few days. If you have a couple of days of increased achiness or soreness in that joint, but it's manageable and tolerable and it settles down after a 2-day period, that would be an acceptable level of discomfort to work into. If you found that your pain was significantly increased after your exercise for a 3 or 4-day period, that's probably a sign that we're just overloading things a little bit too quickly. Tip number 6 is a little bonus tip. It's not essential, but it can provide you with a bit more motivation and a bit more support whilst you're doing your exercise. And that is trying to do it in a social environment, doing it in a group, doing it in a class, in an environment that you feel safe and supported in, and it also gives you that little bit of accountability. Having to attend something is more likely to make you stick to it for that 12-week period. If, like me, you enjoy spreading some osteoarthritis positivity, then I have put a little shop together and you can find a link to a few t-shirts similar to this in the description below the video. If you have any questions or comments about the things we've discussed in today's video, then fire away in the comments below the video and I'll do my best to help you out. If you've enjoyed the video, consider giving me a thumbs up. It really does help. And if you're new and you want to make sure you don't miss any osteoarthritis help, then hit the subscribe button so you get notified every time I release a new video to help you guys at home. Whilst you're doing all that, I'll see you in the next one.